Hi, today we're gonna go over Medicare basics. So kind of take you back to the beginning, maybe go over some information you weren't aware of, a refresher, but just so you feel a little bit more confident in your Medicare coverage. So first off, this is an example of what your Medicare card might look like. So if you're new to Medicare, you have an idea of what you could be getting in the mail if you're starting to get to that process of turning 65. So, but like I said, today we want to just kind of go over those basics and make you feel comfortable with what coverage you have. So we'll start with Original Medicare. Original Medicare is your Part A and Part B. So that covers 80% of your medical costs, which means you're then responsible for the remaining 20%. So Part A is going to be our inpatient services. I like to remind myself that means once I'm put into the hospital, that's when they would be billing against Part A. The nice thing is for most people, as long as you, or if you're drawing off a spouse, has worked your 40 quarters, this is premium free to you. You've already paid into that. If not, it'd be over $400 per month. So yay, most people have the premium free Part A. Part B is going to be your outpatient services. So that means if I go to the doctor, a specialist, I have labs drawn, durable medical equipment, outpatient surgery, all of that would be under Part B, which is usually a 20% coinsurance. And it does have a monthly premium. For most people, it's $164.90. That did just go down in January. So that would be deducted from your Social Security check every month. So Part A, like we said, is your inpatient services. It's premium free for most people. And then Part B is your outpatient services. And the general public has the $164.90 deducted from their Social Security check every month to cover that premium. Next, we'll go over Part D, as in drug coverage. This is important for people to take out once they turn 65 or are eligible for Medicare. Some people I know are hesitant, maybe if they're not on prescriptions at that time, but if you do not take out drug coverage when you're supposed to, you are subject to a penalty. So what I encourage people to do is find the cheapest premium plan, which this year was $5.80. And that way you can for sure still have coverage and avoiding that penalty. So in our area, there were roughly 22 plans to choose from this year. So those premiums range anywhere from $5.80 to over $100. And then some plans can choose to have a deductible. The highest deductible we saw this year was $505. So in other words, you have several options, but realistically, the only way we can give a good estimate on your drug cost is to actually run a drug plan, which we encourage people to review every single year during open enrollment, which is October through December, to make sure you're on the best drug plan for the following year and your prescriptions will be covered. Some things to keep in mind: the plans can require prior authorization. So let's say you're on a really expensive prescription, that insurance company could require documentation from your physician before they will cover that expensive drug. They can also place quantity limits, which we see more in maybe the opioids, but essentially limiting how many you can receive at a time. And then I'm sure most of you have heard of the coverage gap or donut hole. It doesn't affect everyone. It's if you and your drug insurance plan have paid the $4,660 towards drug costs, then that's what throws you into the donut hole. And you're subject to paying your prescriptions up to 25% copay. So then you have to pay a little bit more money to get out of that. But the nice thing about having someone review your plan is they can tell if and when roughly you will hit the donut hole for the year. So just another reason you always want to review that drug information. So we're also going to go over your additional coverage. So as we indicated, Original Medicare with Part A and B covers 80% of medical costs. So you're responsible for that 20%. So that's why people choose to take out additional coverage to help with that 20%. So option one would be what we call a Medigap, or sometimes you'll hear it as a supplemental plan. So the whole goal of these plans is to basically absorb that 20% cost. So how these policies work, you'll hear people say they have maybe the F plan or a G plan, but essentially they don't have to worry about paying copays or hospital bills, that they have a higher premium each month, and essentially that Medigap is absorbing that 20% cost. These plans also allow you freedom to get healthcare where you choose, so they are not network driven. So anywhere that Medicare is accepted in the US, these plans are accepted. The kicker with these is you have a guarantee right of issue. So it's a one-time experience where you can take out this type of plan and they cannot hold health questions against you. So that is as soon as your Medicare begins, Part A and Part B, you then have a 6-month window to go take out this policy and they can't hold those health questions against you. So naturally, if you've been on Medicare for 5 years, whatever the time frame is, then you are subject to those health questions. Now, some people, if they haven't had any health issues, they can still get on these, but they would be subject to those health screenings. So you can review these policies if you have this kind of plan. There's a 60-day window. It's basically 30 days before you took out the policy and 30 days after. So the high point of these, they cost more each month, and then you would technically need to get a standalone drug plan. So you technically have 2 different policies, but you have the freedom to get the healthcare where you choose. And this is just kind of an example or overview of kind of what these policies look like. So as you can see here, letter G, as in golf, the only thing it's not covering is that Part B deductible, which this year is $226. So in other words, if Bob purchases one of these Medigap policies, the only thing he is subject to pay up front would be that Part B deductible, and then ideally this Medigap is going to come in and pick up the rest of those bills. So like I said, you really have to keep in mind that 6-month guarantee right of issue it can affect when and if you can purchase one of these policies. So option number 2 would be an Advantage plan. So these are the ones you're going to see advertised on TV all the time. So they offer the additional benefits like the dental, vision, silver sneakers, all of that jazz. These plans work very differently compared to the Medicaps. They generally have small copays if you go see your doctor. They have out-of-pocket limits, so the most you would pay in a calendar year towards your medical cost, and they are network driven. So in other words, they can dictate which doctors you go to, which hospitals. And then something else to keep in mind, with those additional benefits they're offering, such as dental, vision, they are contracted with specific doctors for that. So you have to go to whatever dentist they tell you. And every year that can change. So another reason people should strongly take into consideration of reviewing these type of policies during that December to October timeframe is to make sure your doctor is still in network. So these can be very inexpensive per month compared to the Medigap. You just are confined to what networks they utilize. And something else to keep in mind with the out-of-pocket limit, like I said, it's just towards medical. So let's say the out-of-pocket limit for a plan you chose is around $3,400. The co-pays that you're paying on your prescriptions do not go towards that out-of-pocket limit. So just something to keep in mind. Just a reminder on some of the important enrollment periods. We've kind of hinted on these, but the initial enrollment period is for people who are new and coming on to Medicare. So you have 3 months before your birthday, the month of your birthday, and 3 months after to enroll in original Medicare, that Part A and B, and not have a penalty. Then the annual open enrollment period when you can review policies that you've already been established on with Medicare, whether it's the Advantage plans or standalone drug plans. That is October 15th through December 7th. Now, this year, Senior Age did make a few changes. We used to help with those Advantage plans, or MAPD is what you might hear them referenced as. But we chose to step back and allow professional brokers and agents to take over and do that, just because they are ever evolving and they know what they've done the research. They have access to things that we do not. So if you have those types of policies, we do have a local broker or agent list that we would be able to provide to you. However, if you do have just a standalone drug plan, or you'll hear it referred to as a PDP, Senior Age can help review those types of policies. And then we would like to go over some of these important money saving programs. The first would be extra help from Social Security. And what this program does, it helps with that Part D, as in drug coverage. So the premiums tied in with that, co-pays, etc. It can help with all of that. There are income guidelines, though, which we have listed here. And your SCL would also have these digits or figures available for you. So if you have questions about that, either let your SCL or administrator there at the senior center know, or of course you can reach out to myself or Isabel. But there are income guidelines to this. The monthly income between whether you're single or married is listed here. But then, of course, monetary assets are a consideration. So that's checking, savings, stocks, bonds. You can naturally still have one home and a vehicle, but if you own multiple properties, that's probably going to eliminate you from this. The next three listed here, the QI1, the SLMB, and QMB, they're all what we would call a Medicare savings program. And the goal of these, depending on which level of assistance, you can have a little bit more help, but basically they're helping with that Part B premium, the $164.90 we discussed. So essentially, if you meet the income guidelines for this program, that $164.90 would no longer be deducted from your Social Security check. It would actually go back in your pocket each month. So if you look at these figures and it seems like you qualify and you don't have the assistance, please let us know, and that way we can help with the application process. Same for Medicaid. So they have much lower income guidelines, and those will potentially be changing here in the next few weeks. But basically, that with Medicaid, it is just health insurance. It's from the state of Missouri. So in the Medicare world, Medicare would pay first, and then whatever isn't covered by Medicare, Medicaid comes in and picks the rest of that up. So there again, if it looks like you qualify for this and you're not receiving the assistance, please let us know so we can help you with those applications. Some additional resources or reminders. Fraud is huge in the Medicare world, just like it is everywhere else, but they do lose billions of dollars every year due to fraud. So we strongly encourage people, once you get that Medicare summary notice, to look it over, and if it shows that you got a cane or something and you didn't, there's a number to call on that Medicare summary notice, or we have it listed here. Please call and let them know that that was not legitimate. It could have been a simple billing error, or it could indeed be fraud. So we also keep in contact with our S&P program, and they're always trying to keep us ahead of any new fraud taking place. And then for Medicare and Marketplace, I know some people have heard of Marketplace, Obamacare, there's all kinds of verbiage thrown out there. But essentially, if someone is on Marketplace before turning 65, they do have to then take out Medicare, as long as they're premium-free Part A. So in other words, Marketplace and Medicare don't work together. So if you're that person about to turn 65 and you are on Marketplace, of course, get with us so we can go over some of your Medicare options, but you would want to cancel that Marketplace insurance about 15 days before your Medicare begins. And then the South Central Pensions Right Project, we always love to share about them. They are a group of volunteers that will research your working history and make sure there's not a pension out there floating around you never took advantage of. So if you have any questions about Medicare in general, these state assistance programs, please reach out to either your administrator and they can get you connected with us, or have myself, Jennifer Tennyson, my phone number listed, or my coworker, Isabel Guzman, her phone number, and we will gladly go over any questions you have. We appreciate your time here today, learning about Medicare. We encourage you to keep coming out to the Senior Center, take advantage of those wellness programs. I know these gals do a great job going over some things to help you guys remain safely in your home and healthy. So we appreciate you, and I hope that you enjoy the rest of your day.